Everyone, let's go over Quervain's, or I like to say Quervain's, so I can spell it, Tenosynovitis. And this is going to be talking about the thumb slash wrist and hand. So those of you who struggle with hand stuff, here we go. So let's talk about the anatomy associated with it. We have the extensor pollicis brevis tendon and the abductor pollicis longus tendon. So let's repeat that. The extensor pollicis brevis tendon and the abductor pollicis longus tendon, okay? So what happens is they're kind of right here, right above where they're borders of the anatomical snuff box. And these tendons can get inflamed, and so that's how you end up with this tenosynovitis going on. So we're looking at the area here, right at the proximal lateral radiocarpal joint. So where these tendons kind of cross over the radiocarpal joint to have their action on the thumb, that is the area that starts to get inflamed. So etiology of this. So you can see here a little bit better. So you can see as a patient like abducts all their fingers, you can see if you abduct your finger, your extensor pollicis tendon starts to pop up, and so does your extensor pollicis longus tendon and your abductor, or sorry, extensor pollicis brevis tendon and your abductor pollicis longus tendon. See, it gets a little confusing, guys, but we'll say APL and EPB. That's going to be helpful as well. So this gets inflamed. How does this happen? 99% of the time that I see this in people who aren't pregnant, it is people who are doing a lot of overuse stuff. So had a lot of workman's comp injuries for patients who do a lot with their hands, so screwing things in, even just like working on assembly lines and stuff like that. If you're using your fingers and hands repetitively in your job, that can cause a risk of this happening. So that's pretty common. And pregnancy causes inflammation. If you've ever been pregnant, I haven't, but if you've ever been pregnant, you understand that everything swells, and it swells in places you didn't think that swell. This is one of the places that can swell. As it swells, causes inflammation, can decrease the patient's range of motion, everything causes issues. So that is one of the things that can happen here at this borders of our anatomical snuff box, being the APL and the EPB tendons here. And then racket sports. I feel like racket sports are always going to show up in this like wrist, hand, elbow problem area. There are people who are specialized in tennis players, and they are never without work. Are always hurting themselves somehow. So that's definitely another thing that happens. And it's the pickleballers now. The pickleballers are taking over the world. So that's something you'll see them with. So anyways, here we go. You'll see some inflammation and redness along this proximal area of the radiocarpal joint and on the lateral aspect of the radiocarpal joint. So pain along the borders of the anatomical snuff box, which include those two tendons that are involved. Remember, that's the abductor pollicis longus and the extensor pollicis brevis tendons. So pain with gripping material and pain with gripping and material handling. So the patients that are using their hands a lot to be able to pick up objects and things of that nature and manipulate them, doing that repetitively over time will start to cause the motion to become painful. Pain may radiate up the forearm as well. So people have noticed that it can go all the way up to like the lateral epicondyle sometimes, but most of the time you'll just see it go midway up the forearm there. And swelling and edema may be present, especially for those who are pregnant. That definitely will swell up, and then you'll see some edema in the surrounding area. You might just see it's just like a little bubble almost looking thing sometimes. So you'll also have radial nerve pain. So our radial nerve is going to go down the backside of the forearm, and the radial nerve does innervate both of these structures here. So just keep that in mind as well. And so doesn't like necessarily like go through here, but because of its proximity and if it's swelling and edema, that can start getting compressed because it's like nearby, but it's not like inside. So again, symptoms will worsen with activity. It makes sense. It's an itis, it's an inflammation. The more you're using it, the more inflamed it's becoming. And then they'll have this positive Finkelstein's test, which is fun to say. And so that's where what you're going to do is you have there's multiple ways to do it. The most stereotypical way is kind of what's pictured here. You have the patient put their thumb into like the palm of their hand, okay? And then they'll wrap their fingers around their thumb, and then they'll start to ulnarly deviate. What they'll see is pain that shoots up over the lateral aspect of the radiocarpal joint and then up the forearm. So that is what's going on. So again, you can see here the patient's thumb is wrapped in, all that stuff. If you've ever done like Olympic weightlifting or like CrossFit, there's hook grip where you put your fingers over your thumb. That's kind of the position you're making as you do this Finkelstein's test. So that can help people kind of visualize that a little bit more. Then the overpressure will be stretching the tendons, and that's what causes the pain. So if you stretch a tendon that's already inflamed, it's going to be more inflamed and sad. That's what the positive sign is. So how are we treating it? So the main thing is this thing called a spica splint. And so that's to kind of keep it in a neutral position to help it heal better. So you might see patients wearing this as they're trying to work and stuff like that to keep it from inflaming more. Again, we're going to use modalities to decrease pain. So more in this case, we're using some ice and some IFC 10s kind of stuff. Yeah. Medications can help. So sometimes we'll get steroid injections or they'll be taking steroids, so prednisone or something like that. That can help them. Other anti-inflammatory medications, so any sort of NSAIDs or, topical gels or whatnot, all those can help out. We're going to do range of motion exercises of the thumb, wrists, and hand, general strengthening of the area, so working on some grip strength as well. Soft tissue massage to the affected structures can also be helpful to help decrease pain and get those tendons to get less inflamed as well. So here are keywords: extensor pollicis brevis, abductor pollicis longus, pregnancy, overuse injury, warehouse worker, gamer's thumb. So this is called gamer's thumb. That's the colloquial, I guess, layman's term for it. And then Finkelstein's test is going to be the special test for it. So looking at this, a patient is being seen with Quervain's tenosynovitis in an outpatient facility. What type of splint is this patient most likely wearing? 1, radial gutter splint, 2, dorsal blocking splint, 3, cock-up splint, or 4, spica splint. So I'll give you guys a moment to think about that. All right, guys, so the answer is going to be that spica splint. So that's the one that we just talked about in this picture, this spica splint. That is the number one that is used for this. A radial gutter splint is going to be along that radial side of the arm. And it just kind of holds everything in place, keeps the wrist from moving. This does allow the wrist to move, but it's mostly immobilizing the thumb. So that's going to be a big thing with that. Dorsal blocking splint is more for the fingers. And so that's going to keep them from going into like a hyperextended position. A cock-up splint, it's going to keep the wrist in slight extension. That's used as like a night splint for like somebody who has carpal tunnel syndrome, but the spica splint is 100% most likely being used for a patient who's got Quervain's tenosynovitis. Okay, friends, well, I hope that this helped and made sense to one of these less commonly asked about questions for the MSK system, but I hope that it was helpful, and I'll see you on the next one. Take care, guys.